Lawmakers are calling on the Pentagon to do more to help civilians with massive medical bills from emergency treatment at military facilities. The military has the power to reduce or waive those bills, but that rarely happens. Making matters worse, most of the civilians treated at military hospitals don't have insurance. CBS News consumer investigative correspondent Anna Werner reports.
It looks like the military has been resistant to reducing these bills for civilian patients.
That's Democratic Representative Joaquin Castro from San Antonio, reacting to this government report. It found the Department of Defense rarely provides financial relief to civilians facing large bills for emergency treatment received at military centers. In April last year, we told you the story of Alexis Hernandez, who spent 7 months at a Texas military hospital burn unit after being injured in an explosion. He endured 19 surgeries before being released. Later, the U.S. government sent him this bill, saying he owed the U.S. Treasury $1.7 million.
What did you think when you saw this letter?
Completely hopeless.
Legislation passed in 2020 gave the military the power, as of last year, to reduce or waive those bills. But a year later, the Government Accountability Office report finds that rarely happens. Of nearly 27,000 civilian medical debt cases the GAO reviewed from a 5-year period, only 0.1% were reduced, just 32 cases. It further said while DoD has options to provide financial relief, it does not consistently inform patients about them. Now, Representative Castro and Senator Elizabeth Warren, in a letter to the Secretary of Defense, are demanding answers as to why.
There's a benefit to the military by them being able to treat these patients. So what the military should do is work with private insurers, but also work with patients to reduce these bills and to get rid of exorbitant or extraordinary costs that patients are being billed with.
And Anna joins us now with more. Anna, are there reasons why the military isn't consistently reducing or waiving civilian bills when it's supposed to?
You know, the GAO report in July pointed out that the military has these options and better options since the legislation passed a couple years ago, but seems to really not be using them, and also not tracking what happens with some of these bills, not tracking whether they actually use waivers or reduce these bills. So, you know, if you speak to Representative Castro, for example, he'll tell you that although he gave them the ability in the legislation, they just don't seem to be using it. And so he's talking about additional legislation this year that would mandate that they use these waivers or reductions of cost. Remember, some of these people get huge bills, maybe not $1.7 million, but they're getting bills for tens of thousands of dollars. And 2/3 of the people who wind up receiving emergency treatment at these military facilities, because they are great specialty facilities in many of the places in the country, about 2/3 of those people don't have insurance. So they're on the hook for huge bills.
Well, has there been any response from the Department of Defense or Treasury on this? And is there any possibility of additional legislation on the horizon? You mentioned that Castro would like to see something happening. Is that something that looks like it's actually going to take place?
So DoD didn't respond to this report or to our questions. The Department of Treasury said that they work with DoD. They're taking the recommendations from the report seriously to make sure that their debt collections activities are appropriate. But Representative Castro, it's not clear whether he and others like Senator Warren are willing to wait to see this happen. So he's talking about legislation this year that would in fact require them to put these options into place. The other thing that they said in the report was that they do have these options, but they don't tend to tell people or make them aware of these options. So if you go in there as a patient or your loved one does, you may never be told about them. You may never be aware that actually you could petition to get your bill waived or reduced. And remember, a lot of people who wind up at these military facilities for treatment, these are on an emergency basis. They don't have a choice where they're being taken. It's not like you can choose after a major accident. And it's good for the military, according to the representatives and senators, to have these civilian cases to manage, because it helps prepare their doctors and nurses and specialists to treat soldiers coming off of the military field.
It's a whole other world that you have unlocked here, Anna, that we knew basically nothing about. Before I let you go, though, I want to follow up on that patient that was in your piece that received a bill for more than $1 million, $1.7 million. Do you have any update on his case?
Well, so first of all, after we ran our story, his bill was waived, and that happened. We reported on that last year. But we checked in with him. I spoke with him yesterday. You know, he has now had in total 29 surgeries because he was burned basically all over his body in an explosion. And it's amazing how well he is doing now. You know, when the explosion happened, he was just starting medical school, wanted to be a doctor. Then he had all this happen. It's been a delay. Guess what? Now he is actually in medical school in Puerto Rico. He's doing really well. And he is going to be pursuing specialties that will help people in similar situations to him, physical rehabilitation, that kind of thing. So he is on a mission to help other people who might go through traumatic events like he did. But it's really great to see how well Alexis Hernandez is doing now.
We see him in that white coat, and I'm sure he will approach all of this with such great sensitivity. Anna, thank you.
Yep.